This is a 24/7nursetutors.com lecture. 24/7 Nurse Tutors, providing unlimited tutoring.
Welcome, and thank you for joining us. Pediatrics, Part 1.
Class, let's review. The birth weight doubles at 6 months and triples at 1 year and quadruples at 2 years. What about preschool milestones? At 1 year of age, we see parallel play. Class, what is parallel play? Yes, this is when they sit side by side and play on their own. Around 18 months is when we begin to see them interact more with their playmates. As you know, they are fiercely protective of their toys. What about the 2-year-olds? I heard you say terrible twos. Well, I prefer to call them the terrific twos because many good changes are happening. At around the age of 2, children have an explosion of brain development. They have increased independence and personal preferences and are trying to understand everyone else. At 3, we expect them to be able to ride a tricycle. Let's discuss pain. How can you assess a pediatric client's pain? Remember, pain assessment is based on verbal and nonverbal cues from the child. It is also important to speak with the parents. If one of the parents tell you they are worried because this is not like him, I want you to investigate more. We can also use pain scales to assess pain. FLAC, FACES, the numeric scale. So let's look at these. Let's discuss FLAC first. FLAC is a behavioral observation scale of pain for preverbal or nonverbal clients. What age is this scale suitable for? Less than 3 years of age. What does the acronym FLAC mean? Well, just think about yourself holding a 6-month-old baby who is in pain. What would you see? F is for face. What does a child's face look like? Are they frowning? Do they have their jaws clenched? L is for legs. Are their legs drawn up toward their abdomen? Are they kicking? A is for activity. What is their activity like? Are they jerking? Are they rigid? C is for cry. Is the child screaming? Are they crying steadily? C, consolability. When a parent is there, how are they responding? Are they difficult to console or comfort? As a nurse, how will you use this scale? Well, in patients who are awake, you will observe for about 1 to 5 minutes. We want you to observe the patient's legs and body uncovered. In patients who are asleep, we want you to observe for 5 minutes or longer. Observe body and legs uncovered. If possible, reposition the client. Touch the body and assess for tenseness and tone, and begin to give them a score for each body part. Let's look at FACES pain scale. It is used in children aged 3 to 7. Look at the video. Can you see the Wong-Baker FACES pain rating scale? I have seen nurses use these with kids, and it is ingenious. The kids, depending on the age, actually point to which picture represents them. Another scale we use is the numerical scale. This is the one that you are used to. Hey class, you think you need to know your immunizations? Well, NCLEX states in quote, you must know how to inform the client of appropriate immunization schedules. Class, what is the first vaccine given at birth? Yes, at birth, the first vaccine is a Hep B. Hep B is given at birth, 2 and 6 months. Remember, children can still get their immunizations unless they have a fever of less than 99 degrees Fahrenheit. It is normal to have fever, redness, and soreness at the site 2 to 3 days after injection. Class, here is a schedule for kids 7 to 18 years of age. Please pause this video so you have time to review this. Safety. Class, how can parents prevent accidents? Well, they can lock their cupboards, they can keep poisons out of the reach of children, and they can actually come down to the kids' height to see what it's like in their world. A GI disturbance is a common symptom. Do we induce vomiting? No. There may be burns of the mouth, pharynx, with caustic poisonings. You call the Poison Control Center or 911. That number is 1-800-222-1222. Class, safety is so important. You already know to never induce vomiting. Do you remember the name of the syrup we used to induce vomiting? What was it called? Now, the syrup of Ipecac. Do we use it anymore? No. Never induce vomiting because it is likely to worsen the injuries. So if this child does swallow a poison, who should the parents call? 911. That's right. Did you also say poison control? Very good. Please give me that number. What is the number for poison control? 1-800-222-1222. I will say it again, and please write it down. You never know when you will need this. 1-800-222-1222. Back in the days when I worked in the ER, we had the paramedics bring this gorgeous 5-year-old blonde-haired, blue-eyed, just a beautiful young lady. Class, she had drowned in the swimming pool at the back of the house. The nurses were crying, Mom and Dad were crying. It was hard. And we worked on this little girl. Good news. We brought her back. I was so happy. That was close. And class, almost 1 year later, this little girl came back. Guess what? She drowned in the same swimming pool. My first thought was, no way. Class, safety is so important. Tonsillitis is a viral or bacterial infection in the throat. It can cause inflammation and irritation of the tonsils. Tonsillitis is one of the most common ailments in preschool children, but can also occur at any age. The tonsils help to protect the body from infections. The symptoms of tonsillitis include sore throat and pain when swallowing, fever, difficult swallowing, headaches, white patches in the throat or tonsils, red swollen tonsils, and the ever-popular vomiting. Preoperative preparation includes providing emotional support to the child and family. Make sure informed consent is on file. Providing comfort and minimizing activities or interventions that precipitate bleeding. Place on the abdomen until fully awake. Manage airway. Monitor bleeding, especially new bleeding. Pain medication for at least the first 24 hours. An ice collar. By the way, what is an ice collar, class? Well, ice collars can be made at home by placing ice cubes and water in a Ziploc bag, wrapping the bag in a towel, and placing the collar on the front of the neck. Avoiding oral liquids until fully awake, then liquids and soft foods. Remember, post-op hemorrhage can occur. Maintain the client in prone of Sims position until fully awake to facilitate drainage of secretions and prevent aspiration. Avoid suctioning and coughing to prevent hemorrhage. Encourage cool fluids. Why? Remember, if it's too cold, it can cause spasms. Avoid the use of citrus juices, milk, hot liquids, and do not use straws. Why? Because it may cause discomfort. Remember, the throat is very sore. Cool water, crushed ice, fluids, diluted fruit juices is given first. Avoid red or brown colored liquids. After a tonsillectomy, teach your client to minimize activities or interventions that may precipitate bleeding. Soft foods are started on the first or second postoperative day. Observe postoperative bleeding and other signs of hemorrhage. Teach the family how to home care because bleeding may occur up to 10 days. Yes, the highest risk for bleeding is during the first 24 hours and 7 to 10 days postoperative. Remember, you are more than a conqueror and you will be successful. Join me as we review core content in the next unit.